Hello everyone, this is Vadim Koshkin with GU Oncology Now, and today we have a very special guest with us, Dr. Christos Kyriakopoulos, who will be discussing the results of the CHAARTED2 trial. Christos, do you want to briefly introduce yourself, give a bit of a background?
So my name is Christos Kyriakopoulos and I'm a medical oncologist at the University of Wisconsin-Carbon Cancer Center. Yesterday I had the pleasure and the honor to present the results of CHAARTED2 study, ECOG-ACRIN Cancer that examined the role of adding cabazitaxel to abiraterone for patients with metastatic castration-resistant disease in patients who have previously received docetaxel in the castration-sensitive setting.
Great. And this trial, of course, is a very important cooperative group trial. It started, actually, at this point, many years ago. Give us a bit of a background of the concept behind the trial and sort of how it originated.
Great. So even the name of this study is like a direct reference to the original CHAARTED study that was successfully completed by the ECOG-ACRIN group that showed significant survival benefit from the additional docetaxel for patients with metastatic castration-sensitive disease. The question that we try to answer with CHAARTED2 is what's the optimal treatment for those patients once they develop castration-resistant disease. So the hypothesis was that a second round of chemotherapy with a second-generation androgen receptor inhibitor would be better than like the second-generation androgen receptor inhibitor alone. And we hypothesized that adding 6 cycles of cabazitaxel, which is a second-line chemotherapy, the results would be better compared to single-agent abiraterone, which was one of the standard of care options at the time when we designed the study.
Yeah, and tell us a bit about the results and what you found.
So the results, the primary, so CHAARTED2 is a randomized phase 2 study, so relatively small. What we found is that the additional cabazitaxel prolonged the progression-free survival, which was the primary endpoint of the study, by 5 months, which I think is, it was statistically significant. It's great to see positive results. And of course, the question that we always need to ask ourselves is whether the results are clinically important for the patients. And I think a progression-free survival difference of 5 months is clinically relevant.
No, absolutely. And of course, the treatment landscape, particularly in the hormone-sensitive setting, has shifted somewhat, and we'll discuss that a bit later. But a PFS benefit in a large cooperative group study like this is certainly significant. What about other findings like OS and other things you found?
Yeah, so PSA response, time to PSA progression, and of course overall survival were secondary endpoints of the study. PSA response and time to PSA progression were positive, meaning that the patients who received cabazitaxel did better. However, we didn't observe an overall survival benefit. There are many different reasons for that. So one is that the study was underpowered for that endpoint. It was like a small study. On the other hand, though, most likely, most of the patients who progressed on abiraterone, they had access to cabazitaxel once they progressed, and probably they also had access to other life-prolonging therapies, such as lutetium. Maybe not all the patients on study, but at least quite a few patients that initially enrolled in CHAARTED2.
Because the years of enrollment we're talking about here are?
So the first patient in the study enrolled in May of 2018.
Okay.
And the last one in April of 2021.
Okay. And of course, this is a time during which there were significant shifts in prostate cancer treatment. At the time that the trial was designed, many patients, probably most patients, were not really getting ARSIs in the hormone-sensitive setting.
Correct.
Right? Now most are. And do you feel that's probably the main sort of difference between the prior landscape and where the trial was designed and now?
Exactly. Over the last, I don't know, several years, we have witnessed a significant change in the treatment landscape, especially for patients with metastatic castration-sensitive disease. So besides CHAARTED, we have the Latitude, we have the Stampede, the abiraterone cohort, we have many other studies, including the studies that included treatment with triplet therapies like PIS1 and ARSENS. And I think that most of us right now, we are using chemotherapy in the context of a triplet therapy, meaning that for the patients who receive chemotherapy upfront, like docetaxel, eventually they also receive treatment with abiraterone, darolutamide, or any other treatment. So in a way, CHAARTED2 is in a way clinically relevant nowadays because I mean, CHAARTED2 included patients who were treatment naive with abiraterone or enzalutamide.
Yeah.
But still, I think the study showed that cabazitaxel has good activity and is like an available drug, and it's something that all oncologists have available to offer to their patients once they develop disease progression.
And so what are, of course, there's a lot to learn from this study, even despite the shift in the treatment landscape. But what are some of the next steps, and what are the additional research questions you'll be asking based on this?
I think something that we learned from CHAARTED2 is that there are patients. So not all patients are the same, meaning that we did observe some patients with a really fast progression to once they started abiraterone. So potential focus of future research should be the patients who have a suboptimal response to second generation AR inhibitor, whether this is in probably I would say in the castration sensitive setting. Some of the additional work that we're going to do with this study is we have collected samples for CTC analysis. So this is that was part of the study, and of course we have collected PET scan images. So this is work that is ongoing. As part of the study, we also collected plasma at 3 time points. So this is also something that we're very excited about, and it's something that it's gonna keep us busy over the next few months to few years.
Yeah, a few years more likely. Yeah. You mentioned PET scans. Are these FDG PETs or PSMA?
So at the University of Wisconsin, back when we designed the study, we were focusing more on patients with bone-only metastasis and doing disease assessment using sodium fluoride PET scans. So of course this is also something that has changed, that nowadays most people, or probably everybody, is doing PSMA PET scans. Yeah. But still it's a different tracer, but I think the question that we're going to answer is still pertinent.
Absolutely. Yeah, I mean, I'll also point out that even though you mentioned this is the sample size in this trial is modest relative to some of the other cooperative group studies, but it's still a large trial, and it's still impressive, I would say, to enroll this large amount of patients over that period of time, despite the shifting landscape. So congratulations to you, of course, on leading this effort. I wanted to ask, for just maybe for the benefit of other investigators, well, first of all, junior investigators who are hoping to lead or be involved in cooperative group trials, what were some of the challenges you faced? What advice would you give basically folks trying to participate in this?
So I think the cooperative group mechanism is extremely important, especially for more junior and unestablished investigators. Yeah. I remember I initially presented this concept when I was the first year faculty, literally 6 months out of fellowship. Of course, a lot of things happened since then, but I feel really grateful about ECOG-ACRIN because they gave me the opportunity to design my own study. I had a lot of support, both for the protocol writing and, of course, all the infrastructure of the NCTN. I mean, this is a study. It was not. I mean, ECOG-ACRIN led the effort, but all the cooperative groups basically enrolled patients, and that's why we were able to successfully cross the finish line. I would like to point out that we were also, CHAARTED2 was also affected by the pandemic.
Oh, so absolutely, yeah.
Probably 80 to 90 patients out of the 223 were enrolled during the pandemic, and this is a study that includes chemotherapy. So treating somebody with chemotherapy during the pandemic was pretty challenging.
Yeah, no, that's a very important point to point out as well. That this we have a few studies reading out now that actually enrolled kind of during that time, and this is certainly was a significant challenge. We'll remember that at the time. Well, again, congratulations. This was an amazing effort, and congratulations on the presentation at this meeting.
Thank you very much.